Hi there, this is Erin Harner, IBS, SIBO, and gut health coach, and I am so excited to have my colleague Lindsay Geddes here today to explain pelvic floor dysfunction, pelvic health, and all things constipation, diarrhea, and bladder leaks. So you are in for a treat. All right, so I am here with Lindsay Geddes today, and I'm so excited to have you here. Thanks for joining me.
Thank you for having me, Erin.
Absolutely. So Lindsay is a pelvic floor physical therapist, most well known for helping women stop bladder leaks, urgency and frequency without surgery, medication, or complicated exercises. She has nearly 20 years of experience in health and wellness, and she has helped hundreds of clients with her proven 3-step bladder confidence method. I'm so happy to have you here, Lindsay. We get so many questions in my group and in my community about pelvic problems. So I can't wait to dive into that with you today. Thanks for being here.
Of course.
All right, so I have some questions planned out for you, and we're going to go off script a little bit. But first, I want you to tell me a fun fact about yourself.
Oh my goodness. My fun fact is that I have a cat named Muffin. I'm very surprised she's not with us today. She is a ragdoll cat, and for any of you who know what a ragdoll cat is like, you pick them up and they ragdoll in your hands. And she's kind of like a puppy cat. She follows me everywhere. She sleeps on my pillow. She's about 15, 16 years old now, and she's as sprightly as ever. And she's just like the most friendly, hilarious cat. So that's my fun fact for this week, at least.
Oh, that's awesome. I don't know what a ragdoll cat is, but I'm going to go look it up after we chat today. That's pretty cool. Thanks for sharing. All right, so we have some questions to go through, Lindsay, and we're going to start with something that's very near and dear to those in my community, and that's bowel issues. So I know that bowel issues and bladder leaks are connected, but can you tell me a little bit more about how diarrhea and constipation are connected with bladder leaks? And also, can you explain how the pelvic floor is involved in both? Like, a lot of people don't know what the pelvic floor is, so would you mind diving in there?
Absolutely. That was actually where I was going to start. First, let's just understand what the pelvis and pelvic floor is, because I find time and time again many women, or any person for that matter, don't actually understand this part of their body because either they're not told or they've just never thought about it. So let's just start with a tiny bit of anatomy, and that way when I talk about areas, then you'll kind of be able to picture what it is that I'm talking about. So if we start with the pelvis, here's the pelvis. It's made up of 3 bones. You have a bone on the right and a bone on the left. So when you put your hands on your hips, you're actually putting your hands on your pelvis. You can tell all your friends. The 3rd bone of the pelvis is this triangle-shaped bone called your sacrum. If I had my fingers in your bum crack and I walked down to the tip of your tailbone, that's your tailbone or your coccyx. If I turn this person back around, if I had my finger in your belly button and I walked down to the first bone that I felt, that's your pubic bone here. If you sat on baseball bleachers all afternoon and your sits bones got tired, those are your sits bones there. So if I tip this forward, you'll see that the inside of this pelvis is this beautiful bowl shape, which I think is pretty cool because it houses a lot of things. So for example, anything on the outside of the body between your 2 sits bones or between your 2 legs, the external genitalia is called your vulva. Inside, the tube that goes inside, so that's your vaginal opening. Once it goes inside, that's what we call your vagina. So vulva on the outside, vagina on the inside. The floor or the bottom of that bowl is called the pelvic floor. And it's not only made up of muscles. Many people think that when they hear pelvic floor, that we're only talking about muscles. There are 3 layers of muscles, which are all the red things that you can see here, but there's other things that make up the pelvic floor as well. So there's connective tissue. So many people have heard about fascia, which is a type of connective tissue. There's also blood vessels, so arteries and veins. There are nerves, which control the whole operation. And then there's also ligaments that attach bone to bone and then also suspend some of those pelvic organs up inside of your body. Let's talk about the organs. So on the outside, not an organ, but you've got your clitoris gland, which actually is quite a large gland. It's like a big fishbone shaped gland that wraps on either side of the vagina. You've got your urethra, that's the tube where the pee comes out. That leads to your bladder, which sits right on top of your pelvic floor. You've got your vaginal opening, which leads to your vaginal canal inside of your body, which then leads to your cervix, which is the gateway to your uterus. Your fallopian tubes and ovaries are attached onto there. And then you have your anus, which is your circular set of muscles, which keeps the rectum closed. The rectum is where the stool is stored, or it's supposed to be stored, until it's time to have a bowel movement. And then a little bit of your colon and the rest of your intestines will sit kind of and fill up this bowl. So all of those things live inside of this pelvis. They are all next door neighbors in the same apartment. And in fact, they all kind of share like walls, like just like in an apartment, they all share walls with each other. So they are so intimately connected with each other. I'm going to pause there because that's a lot of information.
Yeah.
Do you yourself have any questions about what I just said or any aha moments? Because I know that you know your followers as well. Do you think anybody else would have any questions about that?
Yeah, no, I think you did a beautiful explanation of all that's going on in there. I think the most striking thing for me is that they're all sitting in that bowl, right? You've got the rectum and the colon and the small intestine that wraps around in there. You have the bladder. So there's a lot going on and a lot that presumably could go wrong if things aren't properly working. Is that correct?
Yeah, absolutely. So like, just to go back to your question, I'll break it down more specifically, but the big picture reason for like how do these involve each other is that they are so connected literally together. They just, if one is happy, the other one will tend to be happier, and if one is unhappy, the other will tend to be unhappier. So that's like big picture, but let's break it down. So gut symptoms or bowel symptoms, whether it's diarrhea, painful diarrhea often, right? Or constipation or digestive pain, but basically any discomfort with digestive issues can create pain in this area. Sometimes we feel pain in the abdomen, the lower abdomen, maybe even around our rectum or anus. Anytime there's pain in that area of the body, and in fact, studies show anytime there's pain anywhere in the body, the pelvic floor muscles tend to contract and get tighter. Why is this important? Because if I tilt this forward, whoops, and I grab a pen as a little pointer, can you see how this goes up and around and on the other side? The pelvic floor muscles actually wrap around the rectum like a horseshoe shape. They are very involved in shaping the rectum. And then the parts of the pelvic floor are the anal sphincters, which help keep the tube where the stool comes out, the anus, the rectum, help keeps that closed. When we have a set of overactive pelvic floor muscles, because we're in a response to pain, it can create quite a kink in the rectum. Everybody has a kink. I have a kink, you have a kink. We actually all want a kink, and we can actually measure in people what the ideal amount of kink is. And that's why we can stand up, and even if we don't have super duper strong pelvic floor muscles, there's still a kink, and that means our stool is not just more easily gonna come down out of our body through gravity. However, the tighter the pelvic floor muscles, the more the kink in that rectum, which means even sometimes if we sit on the toilet to have a bowel movement, if it doesn't unkink, then we're going to have to use a lot more pressure to pass that bowel movement.
Okay.
You then add in the bowel movement is larger, more firmly packed, like a lot of stool is with constipation. That's going to be even more challenging. Sometimes the anal sphincter doesn't actually want to open enough or stay open long enough to allow that stool out. So now we have an evacuation problem, and that can exacerbate or even cause constipation. On the other hand, all of those pelvic floor muscles, they need to be quite coordinated because they help evacuate and keep in the stool when we want there to be. And so with looser stools and diarrhea, we want to make sure that we can keep it in when we want to as well. Yeah. So you would think that, oh, if I'm like a tight muscle, I'm going to be strong. No way. If you went to Costco and you had a basket on your elbow the whole time and kept filling it up the whole walk around the store, and at the very last aisle, you're like, wow, I want to like pick up those dumbbells and check it out and see if I want to buy them. Would you be able to do very many really strong bicep curls with that arm? Probably not. They're tired. And so that's another reason. The last thing that I'll just break down as well is that it isn't necessarily the pelvic floor causing this per se, but the nervous system is highly involved in both digestive function and the pelvic floor, particularly the vagus nerve. So the vagus nerve is often called like that gut pelvis superhighway, and it's the longest cranial nerve. It's a major player in gut, brain, pelvic floor digestive challenges. So in the digestive function, it stimulates peristalsis, which is just a fancy term for contracting the muscles of the intestines to move the stool along and the food along. Secretions are juices for digestion, which is really important for breaking down your food and allowing you to absorb those nutrients, and enzymes as well. It's, not necessarily talking about it today, but it's also involved with like heart rate and breathing rate and that sort of thing. But then also the vagus nerve is highly involved in pelvic floor activity and relaxation. And so if your vagus nerve is off for any reason, stress, anxiety, trauma, an overwhelmed life, pain, like long-term chronic illness, these sorts of things address both the pelvic floor function and the gut function. And then of course, if we're stressed about that, it just starts the cycle all over again. I could go on and on,
so good.
but I think those are some big high-level things about how they're all connected.
Yeah, thanks so much for sharing that, Lindsay. Like, I talk a lot in my group about the gut-brain axis, right? So there's a connection between the gut and the brain, but the thing that you just brought in that's super important here is that the gut and the brain are connected, yes, of course, but also the pelvic floor and the pelvis is all interconnected with that gut-brain connection. It's not just a one or two-way street. It's a many way street that all goes through that vagus nerve. So thanks for explaining that. That's just brilliant.
Yes, yeah.
Amazing. So one thing that you did talk about a little bit, and I just want to define it, is pelvic floor dysfunction. I know that's a term that a lot of people have heard of or used. Would you just define that for us for a second?
Yeah, there is no internationally regulated agreeing, I'm not sure if that's a word either, on pelvic floor dysfunction. Dysfunction just essentially means when it's acting in a way that we don't think it should. And so any muscle in the body should have a certain resting tone. What that means is that there should be a certain amount of tension and activity in it. Even when we're sleeping, there's still a little bit of activity in the muscle, so they're not totally flaccid and soft. So anywhere in the body, we know where there should be a certain amount of activity in the muscles. When we get the muscles to contract, either by cueing it, hey, can you contract this? Or in pelvic floor speak, we often say Kegel. Does it contract to the strength that we want it to? Can it contract the endurance? Can you hold it for as much as we want to? Do you have any speed to it? But that's when we're cueing it. We also want to know, is it turning on and off at the times at which we think it should? And so when you're moving your body, does it turn on? When you're moving, because we know that with different types of movements, the pelvic floor should do different types of things. Yeah. So is it fully lengthening and relaxing and turning off? And is it fully contracting? So that's one option. Is it doing what it should when we want it to keep urine in the bladder, stool in the rectum? And also, is it functioning in all those other ways? So there's lots of different ways to test it. And that's what, if we find anything that we don't believe that should be happening, we'll call it pelvic floor dysfunction.
Okay, that totally makes sense. So dysfunction, lack of function. It's not working how it's supposed to.
Yes.
Okay, amazing. Thanks for defining that for me. So some people in my group experience looser stools and other people experience constipation. So I just want to address both of those individually for just a second and dive just a little bit deeper. So if someone is saying, hey, Erin, every time I do an activity or I'm taking a walk in the woods or doing something, or even just sitting in a chair and they have to run to the bathroom, or they're feeling like they have this urgency, is there anything that you're thinking about there or things that we should keep in mind?
And are you talking about fecal or bowel movement urgency, bladder urgency, or both?
Potentially both. So oftentimes I hear people who have fecal incontinence, so they running to the bathroom or having a lot of diarrhea might also have a bladder leaking or urinary incontinence. So potentially both, or just the fecal incontinence or running to the bathroom.
Yeah. So surprisingly, they're quite different from each other. So let me just start with fecal incontinence. And sometimes this actually gets called anal incontinence, which includes both fecal incontinence, I have a loss of stool or staining, or flatulence incontinence, whereas I can't hold my gas in. You don't have to have both, but sometimes when people have one, they'll have the other. And what's really interesting is that the internal anal sphincter, it's part of that circular set of muscles that keeps the rectum closed. It is a super, super intelligent muscle. Not only is it a muscle that can help close the rectum to keep things in, it's also a very highly sensitive sensor. That sensor senses what is in the rectum and is it liquid, gas, or solid. And so when you have pelvic floor dysfunction, which could be a multitude of things, perhaps maybe your pelvic floor is too tight, it's clenched all day long. We gave some examples there. Perhaps it could be too loose or too weak. Maybe it has some scarring on there from an episiotomy, or sometimes people in childbirth experience something called OASIS, obstetric anal sphincter injuries. And that would be described as when you have a perineal tear that is a grade 3 or a grade 4 most likely. The definition of a grade 4 perineal tear is that it actually goes directly through the anal sphincter, so it's no longer a perfect circle. And when that happens and is not repaired, and sometimes it's not picked up at the moment, when it's not repaired, oftentimes later in life, as we start to experience different changes in our body, it can lead to anal incontinence because it can't keep that rectum or that anus closed. So those are all some very specific examples of why there could be dysfunction there. For anybody who is concerned that maybe I have this OASIS, speak to your family physician. They can do a manual test to test this if they're trained in that. A pelvic floor physical therapist can test this as well. And or you can request an endoanal ultrasound, which is the gold standard for testing this. And you can have it repaired years, decades after the original injury. And so that is one potential reason that you may have a difficult time holding stool in the rectum, because what happens is that that sensor doesn't actually sense very well that there is stool there. So we think that, oh, the stool wasn't there, and all of a sudden it was, I was out walking like you said, or maybe I'm just sitting there, and that's the moment that the stool has come down into the rectum. And that immediately, as soon as it arrived, it caused this urgency. Okay. Potentially not. Potentially that stool, whether it's constipated stool or more liquid stool, it could have been there for quite some time, but the sensor didn't sense it until all of a sudden it was too late. There was either too much pressure or there was too much peristalsis happening. And then the sensor's like, eek, actually, yes, there is there, but then it can't contract or control the anal sphincter fast enough or in a coordinated way, and then we can get some leaking. Does that make sense?
Totally. Yeah. Thank you so much for sharing that. I think these physical changes are one of the things that are so underappreciated, especially in the gut health world. Right? We think about constipation, we think about diarrhea, we think about the consistency of stool and that kind of thing, and we are often not thinking about the actual anatomy of the anal sphincter and what its function is. Its job is to sense the presence of stool and release at the right time. And if that doesn't work properly, we have a problem.
Yes.
So it's just such an underappreciated area. So I'm so glad to have you here, Lindsay. Thanks for being here. So this brings us to the sort of the flip side. And the flip side of the diarrhea problems are the problems with constipation. Is there anything that we should be thinking about when someone comes to me and they say, like, I can't get the poop out, or they have to splint? And maybe you can describe what splinting means. I do have a couple clients who have to splint to go to the bathroom. Yes. Is there anything we should be thinking about there?
Absolutely. So sometimes I have people come to me in my private practice and their number one concern is, I am constipated and can you help me with that? I do run my online program that's very focused on bladder leaks, urgency and frequency, but I also work in a brick and mortar in a pelvic health specialized clinic, and so I treat all things pelvic health. So the way that I describe it is constipation, if we break it down to two like big umbrella terms, is either there is a motility issue, and usually it's that it's moving through the digestive system too slowly, and or it's not getting digested in a way that by the time it gets to the rectum, it's larger, harder packed, drier than it should. Because if it's in your digestive system for longer, that's more time for your body to pull more fluid out of it, because that's the goal, is to get more water in the body, right?
Yeah.
That is your scope of practice. You are the expert there. I have a tiny bit of knowledge there, but I stay in my lane, and I often refer out for people who we identify there's a big motility issue. On the other hand, the other big umbrella reason for constipation is that I can't evacuate it. It's an evacuation issue, because sometimes you can have like a perfectly functioning gut health or gut, but you can't just get it out properly. And what I find time and time again is it comes down to a few pretty common things. One is, I've already sort of talked about it, is that overactive pelvic floor. So an overactive pelvic floor, remember, it's that horseshoe shape that wraps around the rectum, and it keeps that rectum quite kinked. And when it's kinked, it's just a lot harder to get it around there. And perhaps maybe when you're sitting, it's even hard to open up your anus. So a lot of people will also get things like fissures and hemorrhoids. All those sorts of things can be complications of and symptoms of constipation and pelvic floor overactivity. Another common reason can be a type of pelvic organ prolapse called a rectocele. So a rectocele will happen when the rectum, so this is a fake rectum, here's the kink that I talked about. So the rectum is kind of like this oblong or this kind of tunnel-shaped organ. When you end up with a rectocele, you get almost this little extra little pocket. It's like this stretching out of part of the rectum. And the vagina actually lives right in front of it. So when this gets a little bit of a pocket, you will often see or feel a bulge into the vagina. And that's how a lot of women kind of find out that they have a pelvic organ prolapse, is that they feel or sense a heaviness or like a ball or a bulge in their vagina, or they can see something at the entrance or maybe coming out of their vagina. It could be a rectocele. There's other types of pelvic organ prolapse. We won't get into them right today because the big one that I think is really relevant is the rectocele. So just think of it as like an extra little pocket or a little bulge. How does that happen? Yes, we are more prone to these things with vaginal childbirth or pregnancy. There's a lot of extra pressure during pregnancy. And then with vaginal birth, we get a big stretch and a high five on the way out from that baby. And then also, it can also be like very long-term pressure management things. So people who yell a lot, either for sport or for their lifestyle for whatever reason. A lot of like wind instrument players can have a lot of pressure downwards. Heavy lifters, manual labor people who have to sit a lot or maybe have like poor posture, breath holders, these sorts of things, or chronic constipation, because maybe you're spending a lot of time on the toilet, which that just comes down to a gravity thing. You have lots of support around the outside of your pelvic floor. This has no support, and then you're sitting there for long periods of time. That's a lot of pressure downwards. And then you add in a lot of straining or pushing to have a bowel movement. That can lead to that.
Okay.
So why does that cause constipation? Because when the stool is moving down, the stool can actually get stuck in that little pocket. It can be left behind, which means when you have a bowel movement, it feels like you can have, like some will come out, but then it finishes and you're like, I can still feel that there's some in there. And maybe sometimes we wipe and we see stool. We wipe, we still see stool, and we like keep on wiping and we still see it because it's stuck there. So some people figure this out on their own. And us pelvic floor physical therapists will often teach this technique called perineal splinting. So perineal splinting is a technique that you can use that is really helpful for rectoceles or that type of pelvic organ prolapse. Could you use this if you don't officially have a pelvic organ prolapse? Absolutely, because we're just following the rules of anatomy. But it's quite helpful to relocate that little pocket that we talked about. So if we talk about perineal splinting, I usually teach it in kind of two different options. One is like the least invasive, I guess you could say. I usually start with this one because a lot of women are like, yep, I'm going to try that one. I don't want to do anything more than that, but I'll show you both. So here's your vulva. So just to give you a little bit of reorientation, we've got your clitoris up at the top. That tiny little hole there is your urethra. You've got your vaginal opening, your inner labia, your labia minora, and these ones will have the hair, labia majora. I love this model. I don't love how tiny the anus is on there, but that little hole there is supposed to be your anus. This area between the bottom of your vagina and the top of your anus is called your perineum. So we call this perineal splinting. So the first option, so when you sit down to have your bowel movement, what I would suggest, you may not need to do this for your whole bowel movement. If you're feeling that you can get some out just as normal, do your thing, get as much out as you can or as you do. And then when you feel like you need a little bit of support, this is where the splinting comes in. So I'm going to keep it tilted this way, but obviously this would be tilted in this direction when you're sitting on the toilet. So at this stage, you may want to take a little bit of toilet paper, wrap it around your finger, and you place your finger at your perineum, and you're going to push upwards. So I'm going to be pushing this way, like towards me, upwards, towards my belly button, inside of my body, and you can hold that as you do a very gentle bear down, keeping your throat open so you can breathe out as you do that. And essentially what that's doing, if I show you, this is supposed to be the vaginal canal here. When you're doing that, what that's actually doing is putting pressure on the vaginal canal, which, remember, the vagina and the rectum are neighbors, next door neighbors sharing a wall in the same apartment building. When you do that, you're actually relocating that little pocket of stool, so it actually blips it back to the rectum. So then now it's back in this straight little chute and it can come down into the toilet. So that's option one. Wrap a piece of toilet paper, press your finger on the perineum. The other option is to use a finger inside of the vagina. This one is a little bit more direct and can be more effective, particularly if you have a rectocele. For ergonomics, if you use this finger, you'd be very awkward with your elbow around this way. So I say your thumb is the best one to do. So with this one, you don't want to wrap a piece of toilet paper around your thumb because then, you don't want to insert that into your vagina. It's not bad, it's just not going to feel comfortable. But when you come into the bathroom, you may want to wash your hands first before you sit down on the toilet. Again, have your first part of your bowel movement the way that you normally would. And then what you can do is take your thumb and then you're just going to gently insert it into your vagina. It doesn't need to go very far, perhaps maybe just up to that first knuckle. You're going to insert it into your vagina with the pad of your thumb facing down towards the floor, down towards the toilet bowl. And so your finger is in your thumb is in your vagina like so. And if I turn to the side here, you can see that's my vagina. And now when I press my thumb down, can you see how that's pressing my vagina down this way? And what that does is I'm pressing down this way on that extended, that little pocket that we talked about. And when I do that, it relocates that stool back into the rectum. So again, it can be passed more easily.
Brilliant. Thank you so much for explaining that. That's many women have come to me and said, I figured out that splinting helps, and they're not always very specific, right? We're talking about anatomy down there, and it's not always a super comfortable conversation. So for you to show that with a model is so very helpful. Thanks for doing that, Lindsay.
You're welcome.
So this actually brings us to another kind of orientation thing when we're talking about sitting on the toilet. So you mentioned sitting on the toilet can actually contribute to some of these issues. So do you have any thoughts on a squatty potty or a toilet stool? Do you think they're helpful?
In short, they are wildly helpful. I am not affiliated anyway with Squatty Potty, which is one of the most well-known toilet stools out there, but I love them. I recommend them to every one of my clients. Essentially, if you've never heard of one before, they are a stool that is kind of almost in like a U shape, that when you sit on the toilet, you put your feet up on it, and when you're not using it, it tucks around the base of the toilet, so it like tucks away. And essentially what it does is that when you sit and have your knees up, kind of like in a squat position, which is why we call it Squatty Potty, what that does is that it orientates your pelvis and your hips to elongate and relax the pelvic floor. Remember that kink that we talked about? If we can lengthen the pelvic floor and relax it more, encourage that relaxation, it unkinks that rectum and tilts the pelvis in a orientation that actually promotes that straight rectum and allows us to be able to have that bowel movement a lot easier. The other thing that it does is that it can help promote relaxation of the anal sphincter, so it can help let it stay open in order to pass that stool. So that's the first thing. Absolutely. I love toilet stools and I recommend them to everybody. There are a few other kind of tricks that you can use as well. So getting your bum really far back on the toilet is really important. Many of us sit a lot all day long, kind of with our tail tucked under. So we're here like sitting with pressure on your tailbone. If everybody here just right now asks yourself, where do I feel the pressure on my bottom when I'm sitting here? Just take a second. I can almost guarantee that most of you are feeling it around your anus. Especially if you're somebody who sits a lot, that's cutting off the blood supply, the blood flow. This can really lead to things like extra pressure down there, hemorrhoids, fissures, these sorts of things. Ideally, what we want to be is in a position where our sits bones are more back. So I call this the booty scoot. So if you just take your hand and grab your sits bone or the bottom of your bum cheek and scooch it back and do the other one and scooch it back and do the other one and scooch it back, so that you're more feeling like the pressure is on your sits bones or more towards your vagina or your clitoris. That, now can you feel that it's not all on your tailbone or your anus? That's going to allow good blood flow. But the other thing that it does is that it tilts your pelvis into an orientation that helps that angle of the rectum and promotes a better bowel movement because it really helps the pelvic floor muscles. So getting your bum back and your sits bones back so you're tilted forward, that's really helpful. And the other thing is that if we lean forward, that can be helpful as well. So if you can lean forward enough that you are comfortable putting your elbows on your knees, that can be really helpful. But essentially just a little bit of a body lean forward, that can be helpful because it changes the pressure that we have in our abdomen, which can help promote that bowel movement as well.
That's amazing. So if I was to summarize what you just shared, when we're going to the bathroom, we want to elevate our feet, we want to push our bum back on the toilet, and we want to lean forward with our elbows on our knees or elbows on our thighs. Is that correct?
Perfect.
Okay, so legs up, bum back, elbows forward, and that'll be a good anatomical position for pooping.
You bet.
Okay. Not something I was taught as a kid, and I'm sure most people were never taught proper pooping posture, right? This is not a normal conversation we have.
I know.
As are my kids. we have a Squatty Potty on every single toilet. Yes. Like, it is so important.
Yes.
And even when I'm traveling, I know, like, I was traveling recently and I had my suitcase and I brought it into the bathroom and I flipped it on the side and I put my feet up while I was going to the bathroom. It really makes a huge difference.
Yes, as long as there's not a lot of things that fall out, you can even just take the waste bin that's in the bathroom and turn it on its side and put your feet up that way as well. So that's another trick for hotels and such.
Yeah, awesome tip. I love that. Thanks for sharing. All right, so that brings us to our very last question. So we've talked a lot about like constipation and diarrhea and evacuation and motility when it comes to bowel issues. But let's go back to bladder for a minute. So when we're thinking about bladder leaks, if somebody's experiencing bladder leaks, like where do they start? And do you have any next steps that they could take to find out more information or to make some progress there?
Absolutely. So I think, or what I hope is by now that after you've listened to our conversation, that you start to understand that when you have a problem, we have to look beyond exactly the location that we have the problem. So far, when we've talked about, bowel movements, we've talked about the pelvis and the pelvic floor, the nervous system. Like you have to start taking into consideration other things that can be causing this. And with bladder leaks, many of us are told that there's an issue with your pelvic floor and that your pelvic floor is weak and that you need to be able to strengthen it and that the only way you can strengthen it is with Kegel exercises. But here's the thing. Leaking often comes down to a pressure game. If the pressure in and around the bladder is higher than the pressure closing the bladder, you're going to have leaking. So for example, if I filled up a water balloon and I didn't tie a knot on the end and I handed it to my son and let go, the water's going to come pouring out because the pressure inside the balloon is higher than the pressure closing the balloon. The same thing goes with urine and bladder leaks. So what the traditional and I think outdated medical and pelvic health therapy industry says is that it's all about the closing. It's all about the pelvic floor. And yes, sometimes it is. Well, let's just talk about that. We'll break down that. Is a weak or loose pelvic floor the only thing that could do that? No. We've already talked about this clenched or tight pelvic floor. That can also make those muscles inefficient. They don't know what to do. They don't have endurance. They're not able to turn on at the right time, turn off at the right time. That can create a tired pelvic floor that's not going to keep the tube where the pee comes out closed. The other thing is, another piece of anatomy that maybe you didn't know about your own body is that the pelvic floor has a left and a right side. So what you can't see on this model is the leg bone. So here's the hip joint. If I'm a leg bone and it goes into there, that would be where your hip joint is. Some of the pelvic floor muscles reach out and attach onto that leg bone, which means some of the pelvic floor muscles are also leg muscles and some of the leg muscles are also pelvic floor muscles. Why is this important? Hands up if you've ever had a toe fracture or an ankle sprain, bunions, plantar fasciitis, Achilles tendonitis, knee injury or surgery, arthritis, anything in your hip. Yes, I bet everybody here, right?
Yeah.
And when you walk differently on that leg because of pain or injury, you need to use muscles on that side way differently than the other side. And many of us, even when the pain or the injury goes away, we never stop walking funny on that side, right? And that will make for a very lopsided pelvic floor. Remember, we talked about that horseshoe shape. If that horseshoe shape is lopsided, it's not going to close that tube very well. And if you give somebody who has a lopsided pelvic floor or a overactive or clenched pelvic floor, which is way more common I find in my practice than a weak pelvic floor, if you give those people Kegels, it will likely make their leaking worse, which is what happened to me back in the day when I was told to do Kegels when I had bladder issues. So on the other end of the spectrum, so, even if I say, okay, medical and pelvic floor therapy industry, I'll go with what you're saying that it's a, close the balloon issue. What about the other end of the spectrum, the pressure in and around the bladder? So even like bloating, digestive issues, that's a lot of extra pressure around there. Yeah. Scar tissues from, hysterectomy, laparoscopies, gallbladder removal, these sorts of things. How we breathe. Did you know that your pelvic floor is a huge part of your core and diaphragm system? How we use our core muscles, our posture, bladder irritability. There are so many ways that a bladder can become quite bossy and squeeze its muscle too much, too soon, and not at the right time. The nervous system responds to that. We talked about the pelvic floor being overactive in response to stress or anxiety or trauma. Same thing with the bladder. There gets to be a lot more pressure in there. So there's lots and lots of things that can actually increase the bladder pressure. So at that point, not only do you need to have a normal pelvic floor, you actually need to have a super pelvic floor to withstand all that pressure coming from the bladder. And so my number one suggestion is there is no one single exercise that's going to make your leaks go away. You need to layer different strategies to energize the tired pelvic floor and to calm that bossy bladder so that there's no winner of that pressure game. And the way that I do this is with my 3-step method that I have developed using the information that I have gleaned from my nearly 20 years in the health and wellness industry. And I've packaged that up into my online program called the Bladder Confidence Solution. So if you want to learn more about this and what could be causing your bladder leaks, if this is something that's challenging for you, it's for bladder leaks, urgency, where it's like, ooh, I got to get to the bathroom right away, or frequency, I'm going to the bathroom more often than I think I should, then that program covers all of that. And Erin actually has a link to my masterclass that runs you through all of the details around that. And once you sign up for that, you can come onto my email list, and I give lots of free resources away that has little bits and bobs that you can start chipping away with, even if you're not in the program.
Oh, that's incredible. Thank you so much, Lindsay. I know so many people with gut issues also have bladder leaks, and my community is going to be, I'm just going to speak for them in advance, because they're going to be so grateful for you explaining all of the nuances of the pelvic floor, right? There are a lot of nuances to pelvic floor health, and it's just not something that we often think of as a factor in gut issues. But gut issues, bladder leaks, the gut-brain connection, the gut-pelvis connection, it's all connected. So I just want to thank you so much for being here. This was an invaluable training, so thank you.
You're welcome.
Do you have any last things that you want to say or words of wisdom to share as we're wrapping up?
I would just say that if you have been chipping away at your digestive issues and you're hitting a plateau, and you haven't been taking all of the amazing advice yet from Erin, which you absolutely should if you haven't, but you could think outside the box a little bit and see if you have a pelvic floor dysfunction issue that could be causing your plateau with your digestive issues.
So good. We talked about a lot of things today in our conversation, and I just want to share that if you are struggling with constipation in particular, Lindsay shared a lot of information about the relationship between constipation and pelvic health and bladder health as well. I have a guide called How I Got Rid of Constipation that I want to share with you, so go ahead and click the link below.